Well, welcome everyone. Welcome everyone to the May installment of our virtual conversations. As many of you are most likely aware, it is Mental Health Awareness Month. And so given, recent events that have happened in our city and across the country, we felt like it was time to kind of peel back the layers a little bit and provide a forum that will help us kind of frame and reframe mental health and how it impacts our community. So today, our subject matter experts will focus on key indicators of mental illness, the correlation between adolescent experiences and juvenile mental health and juvenile crime, law enforcement's response to mental health in the community, and we will provide you with some available resources. They will be in the chat, and if necessary, we'll talk about if you need specific information, we can provide that to you one-on-one. We are thrilled to have with us today two professionals in the field of mental health, Laurie Powell, who is CEO of Alliance Health Services, and Thurston Smith, Associate Professor of Psychology and Sociology at Graceland University and Adjunct Professor at Union University. And I should let you know that Laurie is a recent graduate of the 2023 Executive Program, and Thurston is a graduate of 2013, so they're exactly 10 years apart. But I'm sure they would tell you they both represent the best classes ever. So before we get started, I am Michelle Dooner. I'm Director of Development and Alumni Engagement with Leadership Memphis. We also have Austin Brown, who is our Coordinator of Alumni Engagement and Development. And finally, we have several other staff on the line today, but most importantly, we have our President and CEO, Reggie Crenshaw, who is going to welcome everyone and turn it over to our subject matter expert. So Reggie, take it away.
Well, good afternoon, everyone. I am extremely excited to be able to hear and listen to the panelists that we're going to have today. I know that Thurston is an amazing person, a person who has a lot of credentials that we have yet to even talk about, just given the fact that he sits on a number of panels for the White House. He is also a person that has done a lot of work within this community and outside this community. I'm very curious to hear what Laurie is going to say as she works and does so much for Alliance Health in this particular market. And I really want to hear today around emotional intelligence and how that plays a part in our ability to be able to rationalize things that are happening each and every day. So I've had these sidebar conversations with both of them, and I'm super impressed with both of them. And I really feel like the conversation is needed right now for what we're dealing with in our community. So without further ado, I am so excited to pass it on to Laurie so that Laurie can get the discussion going.
Thank you so much, Reggie. I'm excited to be here today. I did want to point out my lapel that I have here. It's May is Mental Health Awareness Month, and this is a perfect time to be having this conversation. And I met Thurston a few years ago, and I've enjoyed getting to know him a little bit. So we'll continue to work together around this important work. We do have some questions prepared that we're going to kick off with. And so to start it off, I just wanted to ask Thurston, could you outline some of the most common signs and symptoms of someone who might be suffering from mental illness?
Well, great question, Laurie. First and foremost, I'd like to thank Reggie Crenshaw and the entire Leadership Memphis executive staff, board members, the entire gamut for the opportunity to join you all today. And yes, this conversation that we're having is extremely important. So I want to thank all of the tons of participants that have decided to give up at least part of their lunch hour to join us for the day. So it's important to understand when we're having this conversation and discussion about mental illnesses that number one is that mental illness, and this is not put out there publicly in the fashion that it should be, but mental illness is in fact the same doctors, the same panel or cohort of doctors of the American Psychiatric Association, the American medical and so forth, those panelists and reputable physicians of the World Health Organization, those same individuals that diagnose all of your other healthcare conditions, heart disease, cancer, eye diseases, the whole gamut, the same doctors or the same panel cohort of doctors that diagnose medical conditions also diagnose issues pertaining to mental health. And so just like you go to a cardiologist for heart disease, a podiatrist for foot problems, an ophthalmologist for eye problems, thus the brain gets unhealthy too. So when we're having this conversation regarding the signs and symptoms of mental illness, let's understand these particular nuances, is that symptoms actually belong to the individual. So they're not your symptoms, right? But signs, or we generally categorize signs as those particular behavioral traits and customs and practices of an individual may become observable to others. So here's the other piece that I want everyone to understand. When it comes to identifying signs and symptoms of someone that may be experiencing some type of mental health problem, it would be most common if you knew that person. So for example, if you know someone that at work that you know to never be late, for example, someone, that's always Johnny on the spot, but then you start seeing this pattern of someone who you know that regularly and consistently arrives to work on time, and now they're coming in 5, 10, 15, 20 minutes late, not calling in. That may be a sign. Another common sign of people that may be experiencing a mental health problem is relating to their dress. So thus, that might include individuals who you see an obvious shift, a shift in appearance that deviates from what you know to be common and normal for that person. Here's something else, something that all of us observe, and this is something obvious that I'm sure everyone on this call has witnessed. Many of us see people that are homeless, regardless of what city you live in. If you live in Memphis, we've got a fairly moderate population of homeless. And it's not uncommon to walking down Main Street or even driving and stopping at a stop sign and see people engaged, if you will, right? Engaged in very rigorous conversations by themselves, right? That is an example of psychosis. So essentially, and here's one important thing is, as it relates to mental illness, particularly with that population, there are some individuals that become homeless, and as a result of being homeless and staying in that condition for an extended period of time, a mental illness, while there are others that have a history, if you will, of mental illness and then become homeless subsequent to their mental illness and other problems. So there are a variety of signs and symptoms relating to mental illness, and some of those also apply to individuals that are suffering from substance use disorders as well.
Okay, thanks for that. And some of the other things like not ability to sleep well, you're not sleeping well, nervousness, social isolation, and of course the list goes on and on. But thank you for that. Let's also look at something we've been talking about lately. Do you think there's evidence that supports that certain zip codes, specifically we're talking about Memphis, experience higher rates of trauma, which leads to increased mental health disparities? Like
Absolutely. There is an overwhelming amount of data that both validates and supports that communities, typically urban communities and communities that are predominantly populated by African Americans, have higher rates of trauma. And I'm glad that, because this serves as a segue into part of that discussion. There are three kinds of trauma, and there are three types of trauma. The three kinds of trauma are historical, generational, and community. I'll give you a brief synopsis of all three. An example of historical trauma, and I'm not being Pollyanna about this, is enslavement. The enslavement of African Americans has had, and there's an overwhelming research to support this, that dysfunction and poor trends of coping have followed from generation to generation within the African American community, all the way from the 17th, 18th centuries. Generational trauma, an example of that is the dysfunctional practices and all of these conditions related to that have been passed on from family to family. And if any family members that have a history of mental illness, I can almost guarantee you in most instances, there is a history of some of that same dysfunction from generation, if you don't mind accepting that as an example. The third one is community trauma, which definitely Memphis fits into this category, because what we're witnessing there is the trauma that's being self-imposed on the community by the community. Those are the three kinds of trauma. The three types of trauma: acute, complex, and chronic. Acute trauma is exemplified by a single incident, and it can be a natural disaster, it can be a bomb threat, it can be an active shooter, it can be you or someone or witnessing someone in your family being harmed by violence. It's acute, but nonetheless, the symptoms are still evident and present. Chronic trauma, or an example of that, is trauma where the symptoms are both pervasive and enduring. So, for example, I broke my finger many, many years ago when I was in the reserve. That one incident is an example of acute trauma. Every now and then, without me doing anything to it at all, this finger will start hurting. Thus, the symptoms, the same symptoms that occurred when the injury took place, start acting up. That's an example, if you will, of chronic trauma. Complex trauma is the exposure to varying or different types of trauma, or the same trauma over and over again. And so when we look at the complexity of trauma, and one example of that, I don't think all of us would agree with this, the prevalence of crime, particularly within the African American community, is representative of all three of those types of trauma: acute, chronic, and complex.
Tied to those zip codes we just talked about as well.
Absolutely.
All right. Can you tell us, and this ties into our next question, what ACEs is and its impact on community health?
Okay. Well, ACEs are adverse childhood experiences. ACEs represent a series of events or occurrences that occur in children up to the age of 18. Examples of ACEs can include mental illness within the parents, dysfunctional substance abuse within the family, divorce is one of the ACEs, childhood abuse, childhood trauma, childhood sexual, childhood neglect are all ACEs. And so when we look at the entire framework of ACEs, it gives us somewhat of, if you will, Laurie, of a roadmap, as it allows us to almost predict that if those conditions are not put in check, if those conditions are not, and if those conditions are not treated, there is a greater probability that those children, once they move into adulthood, will not only carry those same traits and conditions into adulthood, but thus those conditions are likely to be exacerbated. And if you don't mind me sharing this, and this is particularly important when we start talking about the correlation between mental illness and criminality. Criminality begins during childhood. So I will explain further. If a child, like we witness day in and day out in Memphis, Tennessee, are involved in repetitive acts of violence and crime and disregard for laws and disregard for their fellow man, that is indicative of what is referred to in the Diagnostic and Statistical Manual for Mental Disorders as conduct disorder. Conduct disorder, very similar to ACEs, has its caveat once the child reaches 18. And so here's the very important thing I want your audience to understand. Once that child reaches the age of 18, if two conditions, if the behaviors persist, A, and B, if they become diagnosed at, once they reach the age of 18, that conduct order then turns in what is referred to as antisocial personality disorder. So for the sake of the edification of the educational experience, antisocial personality disorder is essentially the clinical disorder for criminality.
Right.
And please let me add this piece. Please keep in mind that I'm not speaking about someone that out of nowhere breaks the law. When we're speaking about antisocial personality disorder or criminality, we're talking about a pervasive and deliberate and persistent pattern of the violation of law, disregard for others, and so on and so forth.
Right. And that kind of leads, you were talking about crime and the conduct disorder. Let's talk about what's happening in juvenile court. Do you think that there should be more counseling in juvenile court? Do you believe it would positively impact, those that are in the system?
Absolutely. Would 3 times over as a former board member appointed by the mayor 3 times and the Shelby County Commission to the Shelby County Juvenile Justice Consortium, and in fact, graduate of the 2017 Leadership Memphis Juvenile Justice Cohort Program. I can't emphasize how very, very early intervention is, and thus how very important it is to have counseling, a robust and comprehensive counseling program within our county juvenile justice system.
Okay. And when we were talking about conduct disorder, we have clinicians here at Alliance. One of the things I ask them to look at if they give a conduct disorder diagnosis is to make sure they're doing a thorough evaluation of trauma, because that individual has likely to have had some trauma, and we need to treat that and help them, deal effectively with that trauma. The next question is around the police department. I know we've talked a lot in the news about the police and the CIT. CIT stands for Crisis Intervention Team, right? And that was, many people don't know that the CIT model that was founded here in Memphis. And if you could talk a little bit about Memphis implemented the Crisis Intervention Team, and currently there's around 200 officers who are trained to handle these mental health situations using that model of de-escalation. Right. Do you believe this is an adequate response from the police, or should there be some other practices scaled up, for example, or what's your thoughts on that?
Well, I would have to give a big shout out to the crisis intervention model, because my old supervisor, Dr. Thomas Kirchberg, psychologist in mental health at the Veterans Health Administration, was the principal facilitator and introductor of that model to Memphis. And so the crisis intervention team model it utilizes evidence-based methodology as a way of, like you referenced, Laurie, with de-escalation and having soft techniques in dealing with very crisis-oriented situations that law enforcement may encounter. And with the understanding, we must understand that if you're a law enforcement officer, that is that very specific discipline. Law enforcement officers and the general public needs to understand this. And I'm definitely an advocate for training of law enforcement, but law enforcement officers are not psychologists, they're not counselors. And so give a major shout out to the Memphis Police Department for promoting the training of its staff in a model that is based essentially in behavioral interventions in psychology to help mitigate, prevent, and reduce the escalation of problems during certain instances where crimes may be perceived to have taken place and/or are taking place.
I did want to give a shout out to a new model called the Care Team model that my agency is involved in. It's called the Crisis Assessment Response to Emergencies. That's an alliance master's level therapist partnered with a CIT officer and a paramedic. So out in the field together, the three of them can triage and get the person immediately to the care level of care that's needed. So that's relatively new. And then our new partnership with the sheriff's office, where it's an alliance therapist and a sheriff's officer going out into the community. So I hope that we'll be able to do so much more in response to mental health crises and to help them keep out of jail and into treatment.
Correct.
All right. The next question, what resources are available for someone suffering from mental illness? How can we help people that are needing help get to those resources? We hear this question a lot. A lot of people say, where do I go for help?
Well, great question. So let's begin with this. I'll preface my response with this statement. We have much work to do in the area of reducing and mitigating the stigma surrounding mental health. There's still lots of folks would rather say I'm HIV positive than saying that, if you will.
That's true. Or I'm an alcoholic.
Even that now. And there's obviously, thank you for that, Laurie, there's obviously still a great deal of stigma suffering as it pertains to individuals suffering with substance use disorders. So we have great deal of work to do in the area of stigma. And let me say that this is particularly within the African-American community, which is a challenge. So one of the things that I've been doing within the ecumenical and the faith community is having conversations with great leaders like Pastor Darrell Harrington, who I know is on, regarding what we can do within the community with making it okay, giving people permission and not shaming them. So and I think that shame piece applies across the board, not just within the Black community, but with the entire community. Right. Let's get the shame out of individuals or needing and requiring assistance for whatever condition they may be experiencing. So that's number one. Number two, as the former chair of Shelby County Mayor's Lee Harris's Healthcare Access Committee, assisting the mayor with establishing policies surrounding the framework for improving access for not just general health care, but mental health care was a key policy priority with the committee that I chaired. And part of that, those recommendations that we gave Mayor Harris, was to have more public service announcements within Memphis. Billboards on the Matter buses, some TV commercials, letting folks know that it's okay, if you're experiencing some type of mental health challenge and that kind of thing, and that it's okay to receive treatment. But here's the important thing that I want the audience to know. None of us are perfectly wholesome. According to the U.S. Department of Health and Human Services, 1 out of 5 and this is a modest assessment, 1 out of 5 individuals suffers from a mental health disorder. And at least 50% of those individuals suffer from a substance use. So it tells us is that both the prominence and prevalence of mental health problems permeates throughout our society. And if you don't mind me saying this, many of those individuals that do presently suffer with some type of mental health disorder or mental health challenge or condition are not even aware of it. So thus, we have the category of those that we know, and we have the categories of those that are oblivious to what they're experiencing at the time.
We have time for a couple of other questions because I know we're going to have some people that want to ask their individual questions. But one of the things we keep hearing about is the rise in suicide. What do you think is going on there? What do you think is impacting that?
We live in a very traumatic environment, the entire American society. So let me respond to that question with a question. Have any of you in the audience ever had something traumatic happen to you that it was so profound that you'll never forget it? Right. If the answer to that is yes, imagine being exposed to that same experience or event multiple times over. The problem that we're experiencing in Memphis, and I see this on an everyday basis, I live in a very healthy community right outside the city line. We speak to each other, we look out for each other, everybody welcomes each other with passion and warmth. I cross over the Memphis city line, and it's a game changer. There are people that live in Memphis that have not, and other places throughout the United States, Laurie, that have not been a healthy environment. Thus, they don't know what a healthy environment is. And what I'm really trying to say with that, we have actually, because we have adapted to this very tumultuous and traumatic environment in American society, we have in fact grown accustomed to this, which is in fact unhealthy in itself. So we have to really put that in perspective when we're looking at this whole paradigm of what mental wellness is and what mental illness is all together.
Right. And you said in your neighborhood, people greet each other, they're friendly. I know Reggie mentioned earlier about emotional intelligence. Some children don't know what's an appropriate social interaction. And we have to teach that to them, I believe. They do not have any idea.
So let me give you an example. Reggie and I had this conversation about 3 weeks ago. One good measurement of emotional intelligence, and I think the audience will be able to massage and wrap their around this. Let's just say that you're driving down I-40 and someone cuts you off, right? And so here's the emotional intelligence scale. From a scale from 1 to 10, with 1 meaning that it's no big deal, and 10 meaning that was the worst, the very worst possible thing could happen to you. On the scale of emotional intelligence, if your response to the event was an 8 or a 9, meaning that you become extremely aggressive, very, very angry, chase after the person down the highway to flip them a bird or cuss them out, and that does not equally invent the weight of the event, that's an example of someone whose emotional intelligence is kiltered, if that makes sense. And so what that really means when we're having this conversation about emotional intelligence, it's about the ability to assess what's happening around us and respond, not necessarily react, with an equal amount or, sensible and mature response to what's occurring rather than an aggravated and aggressive response.
I think you've addressed some of the other questions that I was going to ask you earlier, but what I think it's important for us to end with our questions, What are some strategies to prevent mental illness, treat mental illness? You talked about those predictive factors of trauma, for example, and that can lead to mental illness. What are some strategies that can help you perhaps cope, perhaps might prevent you from developing a mental illness?
Wow, this is great. And so I have to be perfectly honest with you. I'm not confident, right, about how we go about preventing mental illness. And the reason for that is because there are both environmental and genetic or hereditary factors that make an individual susceptible to developing mental illness. Is it preventable? Yes, but it's not necessarily tied to an individual, but more so tied to family, environment, the whole gamut. Now, when we look at addressing mental illness, there are a multitude of things that we can do, Laurie, to for early intervention and minimizing the likelihood of exacerbating those conditions. And part of that goes back to your historical question that we came out of the gate with, which had to do with how do we identify it. And so for those individuals that may have family members or friends that may be struggling, I would encourage a very loving approach to speaking with those individuals. And one way of doing that, Laurie, is simply by having an open conversation with a person. So you wouldn't want to go to somebody and immediately start pointing fingers, because if you do that, you're likely to encounter some resistance and a level of defensiveness. But if there's a loved one, a close friend, a cousin, or a family member, even a coworker, that you have a healthy relationship with, someone that trusts you, then during those instances, you can actually begin to have a conversation with those individuals and perhaps point them to some resources like Alliance Healthcare, some of the local clinical practitioners, private practices, things of that nature. If they're veterans, you can send them to the VA and so on and so forth. And so what's very important is for us to continue to have very open conversations, non-threatening conversations about these issues pertaining to mental health and mental health.
Okay, thank you. Do we have any questions? If we don't, I have a few more questions to ask Thurston. Do we have any at this time? I don't think
Laurie,
yes.
there is a question in the chat. I don't know if you've answered it.
Okay, let's see.
It says, what
is this?
what should
please
a counseling
define-
program?
Okay, what is, for some reason, I don't see
You
that.
see it? Okay, it says, what should a counseling program look like in juvenile court? And what mental health resources should we make more accessible to youth?
Oh, okay.
Fantastic. And by the way, I really didn't introduce myself. I've been evaluating mental health, behavioral health, drug courts, mental health programs for over 23 years for CARF International. So I do this regularly. And so when we look at the models today for comprehensive treatment programs, those programs typically have a multidisciplinary cadre of staff, meaning that those good programs will have licensed clinical social workers, licensed addictions counselors, licensed professional counselors. They will have at least access to at least one psychiatrist and or general physician, nurse practitioners, recreational therapists. And those are particularly prominent within residential programs. Within outpatient programs, there's normally a variation of that. So that's A. B, robust clinical programs for youth and even adults will offer multiple therapeutic models, meaning that they will they will have and utilize multiple intervention methods. For example, cognitive behavioral therapy, rational emotive therapy, 12-step facilitation for individuals suffering with substance use disorder, seeking safety, which is a great model for dealing with individuals that have history of trauma. So good clinical treatment programs will offer a robust menu of clinical approaches rather than just one size fits all.
Yeah,
What was the other? Well, yeah, what was the other part to that question? Go ahead, Laurie, if you want.
Well, I was going to add to that when you said rational emotive therapy. One of the things that our therapists find at Alliance is that from a young age, many children and youth, they don't know how to express their emotions. They don't even know. They might have two: I'm angry, I'm happy, or there's such a huge range of emotions. And then the therapist teaches them about identifying. And then the part that I really love to see is when they learn how to relax. You know, deep breathing, calming yourself down, how to deal with the anger. So many children and youth could benefit from just those basic skills to help they can take anywhere with them, right?
Right,
Visualization,
exactly.
Visualize yourself, you know, somewhere calm and relaxation. So
Exactly.
we have another question. I see, how has the pandemic impacted community mental health? I can speak
Right.
to that as a community mental health provider.
Mhm.
Our therapists, I can speak from a point as a leader. I was really concerned about my staff. We have around 450 staff at Alliance. We immediately went to virtual telehealth, and that was an immediate switch within 2 weeks. And our therapists were hearing so many stories of trauma. We lost many individuals that we were counseling, or some of the therapists lost family members. And we all experienced that together. So we would check in with each other every week. We're still dealing with the after effects, I believe, of just coming out of the pandemic, and learning we're talking more about self-care than we ever have at my agency and other agencies. And we lost some therapists. You're hearing about workforce shortage in different fields. Healthcare, there is a huge workforce shortage now because some of our therapists and some of our nurses that work at our crisis operation, they said we cannot do this anymore for their own mental health. And so we're trying to do more to make sure that people feel cared for, and to recruit more people that this is what they desire to do. But I'm sure you've seen that too, Thurston.
Right, absolutely. And there's a question about recommendations for individuals that need therapy but may not be able to afford. That's very difficult. So I can at least at a bare minimum give you some strategies to help to either stabilize that individual and or reduce it. Number one, exercise. And some of these things are actually preventive. And I know I made a comment about, when the question was asked, how do you prevent mental illness? But mental illness is uniquely tied to general health and well-being, right? And so the same things that you would do to maintain your overall health, keep in mind, is also relevant to your mental health. And so for individuals that may be suffering with a mental health condition that cannot afford to go to a doctor, and can't, for whatever reason that may be, if they are a member of a church, there's that, particularly since the pandemic, have established direct ministries of support within those churches to help members that may be experiencing a variety of challenges, mental health issues among them. That's number one. The National Alliance for Mental Illness, which is which will be emailed to you in tandem with a list of resources that Leadership Memphis is going to be emailing all of you, is another option. Keep in mind, and response goes directly to the earlier question about treatment programs. Mental health and substance use disorders are family diseases. So one essential component for any effective behavioral health treatment program is the inclusion of family and support, meaning that any good treatment program is going to try to bring in your wife, your husband, your children, your brothers and sisters, your friends, to be a part of an integral network to help in your support system. So individuals that may not have the resources to pay for mental health care, their support system is still very, very important.
Well, I'd
So,
like to add a few things to that, Thurston, if you don't mind. The Department of Mental Health has a program called Behavioral Health Safety Net.
yes,
Alliance currently has about 4,000 individuals that qualify for that. To qualify, you must be at 130% of the federal poverty level and have a mental health need. And they expanded that to include children, and children do not have the income requirement that the adults do. And so that's a new program. You can reach out to Alliance. Case Management has the same program. And they are there on Directors Row, I believe, is their facility. I wanted to answer one of the questions that I've seen a couple of times pop up again. Emotional intelligence and what exactly is emotional intelligence. And it's, the ability to perceive, use, and understand and manage and handle emotions. So for example, I have monthly treatment team meetings. I have monthly leadership meetings. I actually gave the book Emotional Intelligence to all my leadership team because we all have different personalities, ways of coping, communicating. And some people, and I'm going to use I have two sons that are teenagers. I'm going to use their word, triggered or whatever. Sometimes somebody might overreact to something someone else has said. And I realize that they might need a little bit more of my attention and time to talk to them about, what's causing this reaction? Are you having some stressors right now? Maybe they perceived this other person coming at them, or maybe they caused a defensive reaction into that person. But its ability to, respond really appropriately, to that other person. It could be in the school setting, workplace, wherever. And they're finding studies that people who are able to manage their emotions and communicate effectively, are able to retain employment and move up in companies better than those that are, I'm going to say, have a hard time communicating appropriately to that situation. Was that helpful? I hope that was enough of an explanation.
Yeah.
Okay, and so do you want to take the next one there? It looks like something about education.
Well, maybe I overlooked it, the scroll button. I did see a question pertaining to, are there any plans to either expand or develop youth programs in Memphis? And so, yes. And I'll be having a conversation
with me later about it.
Laurie Powell, whoever that person was, they must have been listening to our conversation earlier. And if you don't mind me sharing this, Shelby County Commissioner Charlie Caswell, Commissioner for Shelby County District 6, has got several initiatives underway to address youth-related issues within Memphis, as well as providing additional resources, and some of that I hope is funding for expanding our existing youth programs in Memphis and Shelby County.
Right, and I do want to add, and Commissioner Caswell and I'm on his speed dial. So whatever ideas he has, we're going to be there, because we want to. It's important to meet the person where they are in the community. So I have to give a shout out to Pastor Young. Diane Young and the late Bishop Young, because we are at their healing center every Monday night. We have Alliance staff that co-locate in their space. And I think we need to see more of that, like you were mentioning, counselors in the church. So we have several staff that go to the healing center run by Pastor Young, and we do evaluations and link them to treatment on the spot. Maybe they need to go to our crisis center and be admitted for a couple of days. And that's been working really well. And if the ministers trust Pastor Young, then she says, Laurie's okay, you're going to get good care. Then we just kind of continue to address that stigma that way, if that makes sense. So I'm really excited about continuing to expand that. And I'll be happy to talk to you, Thurston, and Commissioner Caswell about what more we can do in that area.
Oh, great. Fantastic. Can you read this last question?
It says, what can be done differently to help educators respond with more emotional intelligence inside the classroom instead of inducing trauma by reacting aggressively? That's a good question.
Well, I think it's great. We all, right? So Laurie and I are both administrative practitioners and in the field, and I'm a teacher, but I'm constantly reading. So there's not this body of knowledge and you're done. You're never done. So those of us that work in the field, those of us that don't work in the field need to be constantly in the process of educating ourselves. If I may speak further to that question, if you don't just become a teacher simply because you have a master's degree in education and stop and you just teach. You teach and you're in this constant evolution of learning yourself and engage, and that includes professional development to not only maintain an effective set of skills, but to enhance them. So all of us have a responsibility, even the general citizen, regarding reading and staying informed as it relates to not just our environment, but how we can contribute to make the community and neighborhoods that we live in and city a safer place to live.
Mm-hmm.
Yes.
And I do want to add that there's been an expansion of a grant with this past legislation. They've added $8 million to a program called School-Based Behavioral Health Liaison. Alliance will have 5. We need much more than that. And there's other agencies providing school-based services. The School-Based Behavioral Health Liaison will be expanded some more with this next fiscal budget. And that program is a pyramid model where the counselors are in the school working with the teachers to identify children and youth who might be experiencing some mental health distress. So they help them identify, educate on trauma, and then do some intervention if needed there. So it's an education and a prevention model that I hope, we'll be able to do more of so we can prevent the, later in life, they call it school to pipeline, prison pipeline. And I just really, that's always been a concern of mine of, we can do so much more with our kids in the school system.
Right. And we need to have more pretrial intervention. We need to divert as much as possible, both youth and adults away. And I don't know if your audience is aware of this. The criminal justice system and the Veterans Health Administration are the 2 largest providers of mental health services in the country. The 3 major criminal justice facilities that provide the most mental health services in America is Rikers Island within New York City, Cook County Jail in Chicago, and the Twin Tower Criminal Justice Complex in Los Angeles, California. Treats mental health patients than any other entity other than the Veterans Health Administration.
Right. There's another question. Would it be value to have, members of different communities in Memphis trained to work with the CIT responders when crisis situations arise?
Oh, I think that's a fantastic question. I am a member as a minister, I'm a member of the, since 2017, I think it was, I went through the program. I'm a member of the MPD Clergy Academy, Clergy Ambassadors Program. And there are several opportunities that MPD provides for individuals wanting to serve their community. Now, some of those individuals, I think, that have very specific disciplines, like members of the clergy and even clinicians like Laurie and I, there are opportunities there to either help train staff or support some of the police during various activities. I would reach out to Pastor Tadario Holmes at the Memphis Police Department. Tadario Holmes, HOLMES TADARIO. And if you need his number, if you reach out to me, whomever you are, I'll provide you his contact information. Great question.
I like that idea, community-based and intervening where the people know you, and, you can prevent that because you're right there in the community with them.
Right.
Okay, thanks for that. There was one more question about, do we think there's enough mental health providers in the field? And I'm going to say absolutely not.
No.
There are not. We're actually doing a health fair today at our Yale. We opened up a new outpatient clinic at Yale, and I've reached out to all of my friends at all the different universities. We've reached out to Union University too. I know that you teach there. Just letting them know we've got job openings, and we're trying to do more things to get the word out there that, to me, it's a life calling. I've been doing this community mental health work for 30 years. I love it. It gets me up in the morning. I love to think of new ideas. And I'm, 71% of our staff are minorities. I really want to find a way to bring more minority males, Thurston, in the field, because I'd love to see more master's level therapists that are male. So I've actually got a team going out there to the universities trying to be like coaches and mentors to say, hey, are you interested in helping other, young men in the community? I think that would just be an awesome thing if we could, increase that pool.
Right. Here's a great response really quick for anybody leaves. This is going to be included in your list of resources sent to you, but they are now entities that are now delivering and training individuals for mental health first aid. Even I am going through that training program, and it's free. So I'm putting that link in the chat, plus the Leadership Memphis staff are going to be emailing that out. So here is another resource that you all can pass on to your family members and network. The training is curriculum based. It's absolutely excellent, and it's delivered in one day over the course of 5 or 6 hours. And it's called Mental Health First Aid, and it leads to a certification as well.
That's a good idea. So to do that, if you're interested in more learning about it, I've been through the training. It's excellent. So.
Right.
Well, we are coming to the close of our hour here, and I just wanted to give everyone an opportunity to send in any last questions. Yes, we are recording this. It will be shared on our website. We will do a post virtual conversation email also with a survey, just a few quick questions to let us know how much you enjoyed today's conversation. It will also be posted on our YouTube channel if you have access to YouTube within the next couple of days. I want to give Reggie an opportunity to close us out. And before I do, I want to say thank you to Laurie and Thurston. This has been such a wonderful conversation. I got so much out of it, and we truly appreciate your time and your expertise and what you do in the community. Thank you very much. So Reggie, I'll turn it to you.
Once again, I just want to thank you for the opportunity to be able to host this wonderful conversation. As you know, most of us are not practitioners as it relates to mental health. We probably have been through our own trauma at some point in time. It's funny, when I took the ACEs survey, I had some traumas that was on the ACEs survey, and mine wasn't as high as other people, but still, we all have gone through some experiences, and the difference is how prepared are we to handle those experiences. So thank you for being available to share with us and providing all the information. I'm so excited that we were able to get this out, and I do think that there's an opportunity for us to have this conversation again. So we'll probably have a part 2 of this session, because I know we barely scratched the surface. So once again, thank you to Laurie, thank you to Thurston, thank you to the team for putting this together. And we certainly will be sending the information out to you shortly.
Thank you.
Thank you.
Thank you, everyone. Have a great day.